Put your hands together for our next speaker, Jodi Wolff.
Okay. Hello, everyone. Again, my name is Jodi Wolff, and my background, I'm a clinical dietitian, and I was in clinical for about 25 years, and most recently I'm in medical affairs with Baxter. But this has always been a passion of mine, nutrition support, and I think that it's really important that we collaborate and work together, and with our healthcare team. And in my time in clinical, what I saw change over the years was that the care became more family-centered, and we would start to have family-centered rounds and include the consumer in the discussions. And so, that led to me thinking that, when we're talking about identifying some of these nutritional deficiencies, we really need to be sure that the consumer is empowered with that knowledge so that if something comes up, that you can go back and talk to your healthcare team. So today we're going to talk about the signs and symptoms of some common nutrient deficiencies. So we won't be able to hit on every possible deficiency, but I really wanted to be sure that we review the most common. We'll talk about the physical signs of malnutrition, because I think it's important that we're able to identify an appropriate nutritional status. And we'll learn how to discuss these findings with the medical team so that there can be further evaluation and treatment if an issue is identified. So what are causes of these nutrient deficiencies? Well, Beth brought up a very important one. With all of the shortages of the different components, it puts you at risk. And so we want to be sure that, that you're equipped and can recognize these deficiencies. So inadequate intake, so it could be that your nutritional regimen is not providing appropriate amounts of vitamins and minerals, the shortages, or perhaps you're getting in you're getting in a lot of the amount, but you're not able to absorb or metabolize it appropriately. Or it could be that you're losing the nutrient with emesis or increased intestinal losses. Some medications could cause these nutrient deficiencies, or medical conditions. So when we look at some of these medical conditions, and I just put these on here, I'm not going to read through the entire slide, but it's important to recognize that some of these conditions are associated with some of the nutrient deficiencies. And so when we look at some of these conditions with the malabsorption, we may see that you would find fat-soluble vitamin deficiencies or essential fatty acid deficiency. And we're going to go through some of these in more detail. So when we're talking about a micronutrient exam, or where to look when you're looking for potential clinical signs. When I was in clinical practice, we would do our exam, kind of a head-to-toe exam, and so we're going to kind of go through it in that manner. So look, when you're talking about evaluating the hair, you're going to look for changes in hair color, the texture, the thickness of the hair. Is there any hair loss? And when evaluating the eyes, you'll take note if there's been any vision changes, any lesions on the white of the eye, the color of the lining of the inside of the eye. And then moving to the mouth, you're going to look for any cracks or fissures that could be in the corners of the mouth, also the inside of the mouth if there are any lesions. There can be some clinical findings on the nails as well. And so you want to look at the shape of the nails, the color, and the texture. We're going to go through some of the findings on each of these areas as well. And evaluating the skin, we want to look at the color of the skin and also if there are any rashes or lesions on the skin. I think it's important for us to remember that when we see some of these changes, it could be that they're not nutrition related. And so, so we really want to be mindful of that. You know, if we see a rash or a particular lesion, it could be that it's related to something else. And so we always want to take note of that. And some of those things could be just stress of illness. So for example, you know, if someone has, you know, a really bad infection or perhaps, you know, they've had some kind of trauma or serious illness, or they're recovering from a surgery, they have a condition known as telogen effluvium, which is where they lose a lot of hair. And that hair loss is not necessarily nutrition related, but it's because of the stress of the illness. It could be a medication side effect. It could be hormonal changes or due to just hygiene or a rheumatoid disease or just age-related changes. So I wanted to take you through some of these changes, and again, keep in mind that they might not be nutrition related, but it would be something that you want to discuss with your healthcare team. So anytime we see any of these changes, you'd want to bring this back to your team and discuss, hey, this is going on, and I'm not sure if it's nutrition related, but this is new for me. So when you look at this picture, what I want you to take note of is it's kind of like a waxy, scaly lesions, and those lesions can be on the scalp or in the folds right around the nose. We call those nasolabial folds right here around the nose, or in the creases right around the mouth, and that can be from a vitamin B6 deficiency. And we can see B6 deficiency in some of those conditions that are listed there, but definitely malnutrition, malabsorption, and some of those. And so it's something to be aware of. So I've seen B6 deficiency several times in clinical practice. And on the scalp, it can look like cradle cap or really bad dandruff, or in the eyebrows, you know, it can be this waxy, scaly buildup. So if you see that, you might want to think B6 deficiency and then talk that over with your medical team to see if maybe something else is going on. The next thing that I want to go over is looking at the hair and skin. If there's hair loss, and there's this picture, actually, it's not that great of a picture, but there's a condition called scaly dermatitis, and it's just what it sounds like, where the skin scales. And you can see that in essential fatty acid deficiency. And so the conditions in which you might see essential fatty acid deficiency would be if you're limiting your lipid infusion and not getting enough essential fatty acids, which we'll talk about, or if you're having malabsorption and or losing, you know, a lot of the fat, or if you're receiving inadequate fat in your enteral regimen or your parenteral regimen. And I think it's important for us to be aware of the dosing, because not all of the lipids that the consumers are receiving are equivalent in essential fatty acids, and so the dosing is different. And so in clinical practice, you know, we've seen some deficiencies as a result of dosing the same way that you would dose with a product that's 100% soy versus one that's lower in soy, because those, you know, the 100% soy is much higher in essential fatty acids, and so when you start getting into some of the other lipids, which are lower in phytosterols, the dosing would change. You always want to check with your healthcare team, your healthcare provider, because they're going to have reasons that they're dosing your lipids at a certain amount. But I think it's important for the consumer to be aware that even though the calories are the same in the lipids, the essential fatty acids are different. This next slide is a picture of something called a Beto spot. And a Beto spot is a foamy, kind of grayish white lesion on the white of the eye. And I've seen this in patients with malabsorption, or I've seen some consumers that have cystic fibrosis and weren't taking their fat-soluble vitamin or their pancreatic enzymes, and they ended up with these Beto spots, and they go away with vitamin A supplementation. But these same, when you see these findings, oftentimes you might see that there's also night blindness because you need vitamin A for vision. And so, so this is something to be aware of as well. That bottom finding where they're pulling down the eyelid, that's really helpful to evaluate for anemia. And the lining of the inside of the eye should be a nice pink color. And so if it's pale or white in color, it could be a sign of anemia. Now, if you saw that, you wouldn't just want to start a supplementation because anemia could be from several different nutrients. And so you'd want your healthcare team to evaluate, is this an iron deficiency? Is it folic acid? Is it B6 causing a microcytic anemia? So, but this is, I think, an easy thing to look at. And so if you did see that it's really white and pale, it might indicate that, hey, maybe I should go to my healthcare team and make sure that, that I have the appropriate nutrients, and then they can do some monitoring. This next picture is called follicular hyperkeratosis. And so when we say follicular, that's the follicle. And so at the hair follicle, if you see these tiny little plugs, again, they're like waxy plugs, they're keratin. And you can see that with vitamin A deficiency or vitamin C deficiency. Also, with vitamin C deficiency, there's something called corkscrew hair. And when you look at the follicle of the hair, instead of it coming out in regular, it actually comes out in the shape of a question mark or a corkscrew. You can see there in that little picture. And that may, again, be an indication of a vitamin C deficiency. And you may see that with, if there's a limited diet or if there's some malabsorption or malnutrition. When we're looking at the mouth, that's where a lot of times we'll see some of those B vitamin deficiencies manifest. And you can see the little baby there. That's a pretty severe case of angular stomatitis. But when you look next to it, that other picture where there's just some slight fissures in the corners of the mouth, that's what I would see more in clinical practice than that severe picture. But it's something just to take note of, that may be a B vitamin deficiency. Oftentimes when we see deficiencies, they don't just happen in a singular way. There's several going on at once. And so this would be something that you'd want to request evaluation with the healthcare team. The bottom picture is scurvy. And so when we think of scurvy, we used to think it's just sailors out on a ship without adequate vitamin C. But I've seen vitamin C deficiency several times in clinical practice. And how it presents, and I'll show you another picture later, but in terms of the mouth, you can get red dots on the tongue and bleeding gums. And when you see bleeding gums, though, we want to remember that bleeding gums can just be a dental hygiene issue, or maybe you need to floss more. It's not necessarily vitamin C deficiency, but we'd want to put it all together with what's going on clinically and decide if it could be vitamin C deficiency. Magenta tongue, so that's when the tongue would actually be that purplish color, and you can see that in a B12 deficiency, riboflavin, folate, niacin deficiency. And so when we think of consumers that are at risk for B12 deficiency, we really want to think about the anatomy, and if you're missing terminal ileum, you're going to be at a higher risk for deficiency, and it may need supplementation. And so, just looking at some of these physical findings. So how does it present? It could present with the tongue, like that bottom picture, being really glassy or swollen, and that's called glossitis. And some of those B vitamin deficiencies present as glossitis as well. This was someone that came to clinic, and he had very severe wounds, and he had a wound vac at home, and he was followed by a team that was caring for his wounds and trying to get them to heal, and he presented with these little pinpoint they were like bruises at the hair follicle, and they're called parafollicular hemorrhages, but tiny pinpoint bruises. And, but he also had some bleeding gums, and the whites of his eyes were also red, where they were kind of hemorrhaging, and his dad thought they were allergies, but in fact, he had a pretty severe vitamin C deficiency. Well, we need vitamin C deficiency for skin and for in order to heal wounds, and so so we, checked his vitamin C level. We actually started him on vitamin C that day just because of his wounds and some of those physical findings. But when we checked his level, it was pretty much undetectable. And so, after a few weeks on vitamin C, his wounds began to heal, and so, but it was really, this finding, that kind of led to an evaluation. And so I think like working closely with your healthcare team, if you see anything that might be abnormal, so that they can just evaluate if, it could potentially be a nutrient deficiency. This is moving to the nails, and when we talk about nails and nutrient deficiencies, there could be a lot of other reasons that you have findings on the nails, but one of them to be mindful of is the shape of the nail. And so the nail should be, a nice downward shape, and it should not curve upward. If it curves upward, and we refer to that as koilonychia, which means spoon-shaped nails. So if the nails are in the shape of a spoon, then that could indicate that there's some kind of anemia going on, or I've seen it several times with iron deficiency anemia, along with other symptoms of anemia. But this is, I think, something really helpful just to note, and also just a finding with iron deficiency, because I had a little girl who had the spoon-shaped nails, and her mom said she was dancing in her sleep, like she had restless leg, like she could never be still when she was sleeping, and that's associated with low ferritin levels, and so we were able to check her iron studies, start her on iron, and over time then the findings improved on her nails, but she also started to sleep better as well. And so that was helpful to have that nail evaluation for her. That middle picture is called splinter hemorrhages, and so those are brownish, reddish vertical lines through the nail that you can see with vitamin C deficiency. And then the bottom picture there is white nail beds, and that can be seen with selenium deficiency. And we have seen selenium deficiency in consumers on long-term PN, so it's something to be mindful of. This is a finding where you could have white nail beds, though, for other reasons that are not related to selenium. So again, it's something that you'd want to review with your healthcare team. This slide is one of the consumers that had intestinal failure with very high output ileostomy, and was not receiving additional zinc in her parenteral nutrition, and ended up with this rash around her mouth and around her nose. And, but she also had these blisters on her hands, which I had not seen before. Those are called vesicobolus lesions. But again, that day we knew that because of her output, we needed to give her more zinc, but we did check her zinc levels. We also sent her to dermatology because we had never seen those blister-like lesions before, and just wanted to be sure we weren't missing something. And sure enough, she had zinc deficiency, and once we replaced the zinc and repleted her and then kept her on appropriate amounts of zinc, these physical findings went away. But that just reminds me that we have all these specialists with like dermatology and ophthalmology and things, and so when we have some of these findings that come up, it's good to work with your healthcare team that's providing the parenteral nutrition or ordering it, but then they have access to specialists that can maybe help figure out what's going on when some of these findings may present. One of the other things with deficiency would be the skin color. And so pallor is when you have that really pale skin and it may look like dark circles under the eyes. And when you look at the palms of the hand, they can be very pale and palmar pallor. And that could be an indication that there's an anemia going on. And again, the anemia, it could be iron or it could be B12, folate, or B6, and so that would be something that your team would evaluate. With anemias too, you could have other symptoms such as you're tired or cold or high heart rate and things like that. So just talking about all those findings if you have those with your team. So now I'm going to move into malnutrition. And I wanted to just, talk about a little bit about malnutrition so that, as you're evaluating, it could be yourself or maybe you're a caregiver, just keeping an eye on some of these things. Because sometimes I think it can be gradual and we don't really realize that, maybe the nutritional regimen is not optimal. And so just realizing, where some of these changes first happen so that the regimen can be optimized. And so I will kind of do this in the same manner, kind of the head to toe. But one of the first places, when consumers are dealing with malnutrition is fat loss happens. And usually we see that happen first. We notice the changes in the face or in the orbital region. And so the orbital region is the area right under in the orbits of the eyes. And that's where you might notice that there's sinking or hollowing in that area. And we want to be careful when we're looking at that finding because sometimes, it might not be that it's malnutrition. It could be a hydration issue if you have the sunken eyes as well. And so kind of just sorting through that. But fat loss in that orbital region would be something we'd look at. The next place that you may see changes would be the buccal area, which is right below the cheekbones. And you can see in that gentleman in the picture there, if it's like sunken or hollow there, that could be a sign of malnutrition. It might just be your bone structure, and it might not be malnutrition, but putting it together with, has there been any weight loss or other findings of malnutrition? Looking at, are the ribs very apparent? Then that could be that there's been some fat wasting. And when you look at the ribs, it could be the ribs in the front of the body or in the back. And then the other place would be the triceps. And we think of triceps are a muscle, right? But in clinical practice, we evaluate that region for fat loss. And so I don't know if you've ever seen those tricep skin fold calipers where they'll use those to evaluate. Well, sometimes we'll do that. We'll just do that with our finger and kind of separate the muscle from the fat and see, is there adequate fat there in that tricep area? And then this is looking at muscle loss. And so when we're evaluating muscle loss, again, one of the first places we might see muscle loss would be the temple region of the head. And so to find that temporal muscle, you could put your fingers here on the side of the head and kind of chew, and you should feel them moving up and down. If there's sinking or if that muscle there feels really kind of squishy, then that could be that there's wasting in that temporalis muscle, which could be an earlier sign of malnutrition. Some other areas where we might see muscle wasting would be that pectoralis muscle. That's the chest muscle. And so if, in women, and a lot of times our clavicle can be more prominent. And that might be normal to have that. But if you can hook your fingers up under that clavicle bone, that may mean that you have wasting there in that chest muscle. And that may be an indicator of some muscle wasting in that area. And men, a lot of times, you shouldn't really have that prominent clavicle bone. And so that would be it would be kind of like a landmark where you'd look for that muscle wasting. Looking at the shoulder muscles, the shoulders should be nice and rounded and curved. So if it's boxy, or if they're very prominent, you might have some muscle wasting there in the shoulders. And then looking at the legs, the quadriceps, there's 4 muscles in the leg that make up, those quadricep muscles. And so if you have wasting there, sometimes you can see really distinct lines in the leg muscles, where that muscle used to be there and perhaps it isn't, or some hanging skin where the muscle has wasted and now you have some skin there. Looking at the back, the trapezius muscles, or those muscles that are in the back where you could see that wing-like bone that's back there, the scapula, that could be an indicator that there's some muscle wasting in the back. And then also in the calf muscle, the calf should be kind of a firm, bulbous type muscle, and so if that is flat or there's some wasting there, that may be an indicator of malnutrition. A lot of times with inadequate nutrition, again, we'll see changes that start in the upper body and then move to the lower body. And then as a result of some of that muscle wasting, we might see some changes in what we refer to as functional status. Functional status is really, our daily activities, and so that differs depending on our lifestyle or, what we're doing. And children, their functional status is playing and going to school and perhaps going to therapy and those kind of things. And so, when we're evaluating changes in functional status, we want to look at what the baseline was and if there's changes in that along the way. So maybe sleeping more, or not wanting to go out and do things, or your energy level is just lower, then that would be a change in functional status, which you may see with malnutrition. So now that we've reviewed some of the vitamin and mineral deficiencies and some basic signs of malnutrition, I wanted to just talk briefly about what to do if you see some of these abnormal findings. And so I think it's really important to notify your healthcare team as soon as possible. And when you do that, come to the visit prepared. And so, sometimes these findings, they may come and go, but I would, encourage you to take a picture if you see something that's abnormal. And I know during COVID, our team was able to do a lot of, we had to do a lot of our visits virtually. And we were able to evaluate, some of these physical findings and nutritional status virtually even. And so caregivers would send us pictures, or we would, we would have virtual visits with them. And so it may be that, they may want to see a picture of what you're seeing, and share that with them. It would be important to bring records if you have high output, or to bring records of your ostomy output if you have an ostomy, or how many bowel movements you're having a day, and what the consistency is, and if there's been a change in your absorption, so that they can kind of help figure all that out. I'm sure they'll evaluate anatomy to see which deficiencies that you may be at risk for. But also bringing a list of any kind of supplements that you're taking. And so sometimes if you're on parenteral nutrition and enteral nutrition, or taking some oral supplements, just bringing all of those and a list of all those with amounts, including any kind of herbal supplements or things like that to the visits, because that'll help them be able to sort through maybe you need additional supplementation, or maybe sometimes what we see is the supplementation, the nutrients are competing with each other. So maybe at one point you had a zinc deficiency and you were put on a high dose of zinc for several weeks, and then that ended up leading to a copper deficiency or an iron deficiency. And so I think bringing a list of your supplements to your visit would be really important. And then, your healthcare provider may then request some blood work, and they'll probably do their own physical exam, or look at stool output or urine output and those kind of things. And then just recognizing that, a lot of times these lab values that we could use to check for some of these deficiencies are affected by inflammation. And so oftentimes, if we would check those levels, we would check it with a C-reactive protein, which would tell us if there's some kind of inflammation going on. At the same time, if that level is super high, it's not a great time to check some of these vitamin and mineral levels because they could be falsely elevated, or they might be falsely low as a result of just inflammation. And so just keeping that in mind when there's an evaluation as well. And then the intervention, if a supplement is started, be sure and take it for the entire course. Sometimes, we would start consumers on a supplementation for a deficiency and then see that, they'd be lost to follow up, or they wouldn't come back for a while, and either they would sit on that same supplement for a while, or they didn't take it and the deficiency got worse. So I think if you are, if you do see that there is a deficiency, really having close follow-up and making sure that, the supplementation was appropriate, because perhaps you needed more than your team thought, and so they should keep a close eye on it and make sure that the physical finding or the clinical condition is improving. And then just keeping in mind that the dosing may vary depending on whether it's IV or parenteral, or whether it's oral or enteral dosing, and they're not equivalent. And also, when you have a true deficiency, the likelihood of correcting it with a multivitamin is slim to none. And so a lot of times to correct, you're going to need a higher dose of that single nutrient. And so that's something to keep in mind too, because sometimes I think, there's thinking that you could just take a vitamin and that will resolve a deficiency, but you really need to be sure that the supplementation is appropriate. So what about some interventions and prevention? So we really want to be sure that, again, you're working closely with your healthcare team, that you're, if you're receiving, parenteral nutrition, that you're receiving, a daily vitamin and trace elements, and hopefully the supply will allow that to happen. Ensure that you're receiving adequate lipid dosing and that that's being monitored, and also consulting with your healthcare team, in these times of shortages. I know you've all had to deal with those, and so a lot of times there's strategies that are put in place to help the existing supply last for the entire country, but as a result, that means that you don't get optimal dosing for what you need. And so just to keep checking with your healthcare team and seeing if do you have to continue. Perhaps they had you on 3 days a week of a vitamin or a specific therapy, and the supply is now better, and you could return to your optimal dosing or daily dosing, which would hopefully prevent a deficiency. So again, just working closely with your team during those shortages and making sure that you can get through that shortage as safely as possible. And then if you're having any kind of intolerance, so changes in your bowel regimen, or you see that your urine output has changed, or your energy level, or you're seeing any of those signs of malnutrition, to just be sure and talk with your healthcare team. And then the last one is just to be sure and with your regimen, whether it be parenteral or if you're receiving a tube feeding, if the schedule is not working for you and you're not able to get it in consistently, make sure your team is working to adjust your regimen so that it works for you, so that you can get your nutrition optimized. Because a lot of times, I think, especially on the hospital side of things, consumers may leave the hospital and something that worked great for the hospital with 24/7 nursing, but might not be good for you and your lifestyle. And so just being sure that the plan that's in place for you is working for you. So I put some just references up there. Aspen, the American Society of Parenteral and Enteral Nutrition, has some great resources that are on their website that you can refer to during shortages. This is likely what your healthcare team is referring to when they do some of these things that they might ask you to do, like reduce the dosing temporarily or things like that. Those all came from a group of experts that looked at the literature and tried to come up with some recommendations to do the safest thing possible when the supply is just not there. And so those are some references, and then we can use the remainder of the time for some questions or discussion. Yes.
I have a lot of problems with restless legs, and I know it's because when my ferritin drops, they start. I have a really hard time with my clinicians to get them to run a ferritin. They only want to, do a CBC and maybe the total iron binding capacity.
Mm.
But because they say the ferritin isn't really reliable, but how do you get them? It is all about my ferritin, and it drops, and it's at low levels. I can't sit down to relax or sleep.
Yeah. Yeah. I'll repeat. I can repeat her question, and so you can correct me if I'm not summarizing it appropriately, but oftentimes healthcare teams may just check a CBC or a hemoglobin and hematocrit to evaluate, iron status, and versus checking the ferritin, which would give us a better indicator of storage. And she was mentioning that with rest, she has restless leg, and she definitely has seen a correlation with ferritin levels. And so I think just asking them, that you could even take a study, and I could help you with that if you want, about ferritin and restless leg, and discussing your physical findings with the team. And I ran into that a lot in clinical practice, where they would want to just look at the hemoglobin and hematocrit, which is affected by fluid status and doesn't really tell you about iron stores. And so just convincing them to do that. Also, we don't want to wait for a full-blown deficiency, and that's how I would communicate with the team as well. When you have anemia, it can affect, the blood is one of the last things to be affected, but it affects, your brain and other, your oxygen carrying capacity and all of that. But it's good if you can look at ferritin and see that your stores aren't great and prevent a possible deficiency. So that might be a way to go about it too, just that you want to be really proactive, that you notice that you're having, these symptoms which you've seen correlating with your ferritin.
And is it common that your hemoglobin will be normal,
Yeah.
but the ferritin will be low?
Yeah, absolutely, and that's partly because it's affected. Hemoglobin and hematocrit are affected by a lot of things, but specifically fluid status. So if it's a day that you're maybe a little more dry or dehydrated, then you could appear to have normal iron if that's the only thing they're looking at, but your stores may be low.
I actually wanted to give you a bit of information that might be helpful. When I came with the company that I'm with now, 25 years ago I joined them, and my dedicated pharmacist and I worked out all the tests that I really needed, because the previous company really wasn't helpful and I wasn't getting really good care. And so we then made a spreadsheet. So actually I made a spreadsheet of all the tests I need to do, and then to help my doctor, who was like, why do you need all these tests? Because he's a gastro doctor, not necessarily a TPN specialist. And I said, well, talk to my pharmacist. And then my pharmacist said she needs this because of this, and this because of this, and this because of this. And it went a long way toward him approving every test that I needed. So that helps a lot.
Yeah, I think that's a good point, is sometimes just understanding the why behind the ask, or why you're wanting to have that tested. But yeah, that's a really good point. Yes.
Just to link on to what you were saying, I'm going to turn it into a question. Clinicians in general, depending on their area of expertise, love the range and not necessarily the balance. So do you have any, you're within normal range. Okay, you're at the very bottom of the normal range, but you're within normal range, so it's completely okay, you're not deficient yet. Do you have any suggestions for everyone on the conversation with either their nutritionist, their dietitian, or their physicians on checking and looking outside the box of, as you were saying earlier, the cause and effect? Your zinc is up now, your copper is down, stuff like that.
Yeah. So I think, well, nutrition is a science and an art, but one thing for sure is you always want to look at the trend. And so if I was having that conversation with a consumer and they were saying, I'm at, like your level's within normal, like I'm going to look at, well, what was your level 3 months ago and 3 months before that? And if you're continuing on a downward trend, I don't want to wait until you're in the abnormal range. And so I think too, just asking the team to, hey, can we review my labs over time and kind of see where I've been trending? And also, it's not just a number, it's how you feel. And so talking about maybe some other symptoms that you're having and seeing if there's a correlation between that and the nutrient, but just having that discussion with them about trends over time. Yes. Okay. Any other questions or wrap it up? Okay.
Do you have any closing words?
No, it's just, I'm just really happy to be here. So thanks for the opportunity. And yeah, I think just it's great now that, that I think consumers and clinicians are working more closely together. So just keep having your voice and keep the conversations going.
Thanks so much for being here. Thanks so much.